Let's talk about sports injury, physical education too. By the end of this video lesson, you will be able to identify common injuries in sports and physical activities, enumerate ways to prevent injuries in sports and physical activities, demonstrate proper etiquette and safe use of facilities and equipment, and observe personal safety protocol to avoid dehydration, overexertion, hypo and hyperthermia during MVPA participation. Overview. Individuals who engage in various types of physical activities such as sports and exercise have a higher risk of getting injuries as compared to those who practice a sedentary lifestyle. However, the potential benefits of an active lifestyle outweigh the risks of suffering the injury. According to several studies, obese individuals and those with poor fitness level have a higher risk of getting injured. Studies also show that injuries are associated with age. Children and older people are also at a higher risk because of poor motor control and weak musculoskeletal structures. There are certain characteristics or factors that increase the likelihood of injury. These risk factors increase the susceptibility of the individual to injury, but it does not cause the injury. Most of the injuries are preventable, and awareness of the risk factors will help in reducing the risk. Furthermore, vigilance and safety measures can dramatically reduce the occurrence of injuries. Sport injury, in the broadest sense, refers to the kinds of injuries that most commonly occur during sports or exercise. Some sports injuries result from accidents, others are due to poor training practices, improper equipment, lack of conditioning, or insufficient warm-up and stretching. I have here a pre-assessment activity to check your prior knowledge regarding sport injury. While watching a basketball game, you saw your friend go for a layup. Another player tried to block his shot and bumped to your friend mid-air. Your friend lost his balance and fell on his back, and his head hits the floor. It took several minutes before your friend was able to get up. You saw him limped as he walked towards the bench holding his head. Now, there are 3 questions for you to answer. You have to write 2 injuries that your friend could have suffered from the fall. Number 2, are these injuries acute or chronic? Why or why not? 3, should your friend be examined by a doctor? Why? Let's have the essential questions. These questions will guide you throughout our lesson. You can copy these questions and later write your answers in another sheet of paper with your full name, grade, and section once you learn the answers to these questions. Essential question number 1. What are the most common sports injuries? Number 2. Why does a body part swell after getting injured? 3. What factors increase the risk of injury? 4. How can the possibility of getting injured while training or playing sports be minimized? Now let's start by defining injuries. Injuries are damaged tissues or organs which occur when it encounters trauma or physical force that is greater than what it can resist or absorb. The tissues are able to withstand varying degrees of stress and strain, but it will break down if it experiences an impact that is stronger than what it can tolerate. Its ability to withstand sudden or acute forces also depends on the tissues that soften the impact on the structure. In general, sport injuries can be classified into acute and chronic or overused injury. Now let's go to acute injury. Acute injury is usually associated with sudden, traumatic events such as clashing into another player during a game or a fall from a bike. A traumatic impact can cause your bone to crack, muscles to tear, and ligaments to snap. Its signs and symptoms, like pain and swelling, manifest immediately after force application. One of the most common acute injury is sprain. Sprain are commonly caused by a sudden or violent twist of a joint with stretching or tearing of ligaments. An individual usually feels a popping sound when a knee ligament is completely torn. The injury commonly occurs when the knee twists while weight is placed on it due to improper landing after a jump, running too fast, or without a warm-up. It's common in soccer, basketball, and volleyball. The injury usually takes several weeks or months to recover depending on its severity. Another common acute injury is strain. Strain is a twist, pull, or tear of muscle or tendon. It is also an acute non-contact injury that results from overstretching or overcontraction. Sometimes a muscle would contract and generate a force that is significantly higher than what it usually does. The forceful strain contraction rapidly pulls the muscle tendon unit, which can result to a muscle strain. The most common strains are located at the lower limbs such as the hamstring and calf muscle. Another acute injury is fracture. Fracture is a broken bone. It can range from a thin crack to a complete break. Bone can fracture crosswise, lengthwise, in several places, or into many pieces. Most fractures happen when a bone is impacted by more force or pressure than it can support. Next acute injury is dislocation. Dislocations are bones that are pushed out from their joint capsule. It commonly occurs in joints that allow greater range of motion. The most common dislocations are located at the upper limbs such as the shoulder and the elbow. These joints are commonly affected when an individual uses his or her weight when she or he falls. When the bone is pushed out of the proper alignment, the injury will cause a deformity and constant pain. Furthermore, the individual will not be able to move the affected limb. The pain will be relieved once the bone is repositioned. One of the most life-threatening acute injury is concussion. Concussion is a mild reversible brain injury from a blow to the head, which may be associated with loss of consciousness. A severe blow to the head could cause the blood vessel in the brain to rupture. As the blood leaks out of the ruptured blood vessels, it will accumulate inside the skull. Another traumatic injury is contusion, where there is a blood underneath the skin due to trauma causing a bruise. Another one is coup contre coup, a contusion present at both sides of the impact and the exact opposite end of the impact. So for example, while nagduwa baron ka, and you were hit in your forehead and natumba, and then the other end sa imuhang head, which is dapit sa imuhang knee, naigo pod sa floor. So that is what contre coup is all about. There are two sides of the impact, ang exact opposite of each end. Next is diffuse axonal injury, or DAI, is similar to a concussion, though the brain is shaken much more violently. If the condition is not resolved immediately, the brain starts to die. It is important for the individual to go to a medical facility as soon as possible so the injury will not worsen. Now we're done with acute injury, so let's go to chronic injury or overused injury. Chronic injury is caused by repeated overuse of muscle groups or joints among individuals who have been training for a long period of time with minimal rest and recovery between sessions. During training, the musculoskeletal structures receive higher loads than what it is used to. However, the body has the ability to heal and recover from this, given enough recovery time and nutrition. Some individuals that train too hard and too soon are not to be able to cope with the increased demand, resulting to microscopic injuries. Poor technique and structural abnormalities can also contribute to the development of chronic injuries. One example of chronic injury is stress fracture. Stress fracture is a small crack or severe bruising in a bone. Most stress fractures are caused by overuse and repetitive activities and are common in runners and athletes who participate in running sports. The individual feels a dull aching pain that worsens over time. This type of fracture does not require immobilization that the individual has to stop exercise for around 4 weeks to give it time to heal. Another chronic injury is tendinopathy or tendinitis. It is the most common injury in sports, which involves the muscle tendon unit. It is usually due to muscle imbalance between muscle pairs. The most common site of tendinitis in the upper limb involves the muscle tendon units around the elbow, and in the lower extremities involves the muscle tendon unit surrounding the knee. The pain usually eases during the activity but will worsen after playing. Next chronic injury is osteoarthritis. It is the wear and tear of a joint that results to its deterioration. The friction deteriorates the cartilage that protects the bones from rubbing against each other. The knee joint is the most common site for the degenerative changes that occur in the cartilage. The condition further aggravates when the individual is overweight or obese. Bursitis is a chronic injury that is common in swimmers and runners. The bursa is a sac-like musculoskeletal structure that provides support and cushioning to the joint. It protects commonly used joints such as shoulders and the knee from repetitive mechanical stress like friction. The inflammation of the bursa interrupts the surrounding structures, causing pain during movement. The recovery period usually takes 2 weeks to a month. The healing process. During acute injuries, the body will initiate the healing process through inflammatory response. The inflammatory response removes the damaged tissue by increasing blood flow and activating the lymphatic system to the injury's site. Swelling occurs due to fluid accumulation as a result of increasing blood flow and blood vessel permeability. Aside from swelling, inflammation is also characterized by pain, redness, and warmth. The muscles surrounding the area contract to guard the injured site and prevent aggravation. The entire healing process takes several months to a year to complete. There are factors that may prolong the healing period, such as too much swelling, limited blood supply, old age, and weak muscle strength. Chronic injuries undergo a similar healing process, but special attention should be given to determine its cause, like muscle imbalance, faulty equipment, poor technique. Individuals should refrain from training until the cause of the injury is identified to avoid recurrence. Most injuries can be prevented with adequate preparation and proper knowledge. The following strategies can minimize the occurrence of these injuries. Adopt a comprehensive training program. It is a holistic program that suits an individual's needs and demands. The program contains the correct exercise and proper execution, as well as posture, corrective exercises, core exercises, stability exercises, and other exercises that will improve neuromuscular efficiency. Use and wear appropriate protective gear and equipment and practice correct technique. While playing a sport, an individual should wear proper protective gears and use correct technique to avoid injury. Incorporate recovery strategies in the training program. While it is important to train and exercise, it is also necessary to incorporate recovery in the routine. An individual should also eat and drink properly to help the body restore lost nutrients. Follow rules and decorum during sport competition. To maintain fairness and safety for everyone involved, rules should be strictly enforced to prevent excessive physical contact that may lead to injuries. Execute proper warm-up before playing and cool-down exercises after playing. Follow an appropriate warm-up and cool-down regimen, including flexibility exercises to increase blood flow in order to soften the tissues and thus prevent injury. Lastly, be physically fit to play a sport. Remember that if you play any sport, you should adequately train for it. Keep yourself healthy by eating the right quality and quantity of food and getting enough rest. All of these preventive measures will help you minimize the possibility of getting injured while training or playing a sport. Now let's have an activity. In Activity 1, you are to identify the type of injury and give the common cause of each injury. You will be given 2 points in each number, which will be a total of 16 points. Write your answer in a one-whole sheet of paper. In Activity 2, choose 2 acute injuries and 2 chronic injuries from the table above and list specific ways to prevent it. You will be given 3 points in each number, which will be a total of 12 points. For assessment, I have here a fitness story. Read the story below and answer the following questions in Test A. For Test B, 1. Identify a modifiable factor that can lead to the greatest reduction in acute injuries and explain how. 2. Describe how poor technique contributes to chronic and overused injury. For Test C, name at least 3 sports that you like and give 2 equipment that can be used to reduce the risk of injury in the following sports. For your performance task, choose an injury from a random set of sports injury discussed in the lesson. Create a skit using a storyboard on a short bond paper. The skit should display how the injury can develop or might occur while playing a sport. You can create your own format depending on how your story flows. Use the rubric below as a guide in making the skit storyboard, as it will be the basis of rating your output. Below are the samples of a skit storyboard. Another performance task is for you to create a source of information material, or SIM. Make a SIM that promotes awareness of sports injury prevention through cut-out pictures, or your own action photos, or drawings, sketches, or painting using any medium available creatively. Follow the format below and read the rubric for you to be guided for the rating of your output.